I'm looking forward to kind of go through it and dig on about the newer updates of the studies. We've had big results of the phase 3's combination in the frontline at last ASH. So there we had an update on ASCO with the Pelabresib Ruxolitinib, which was waiting for the deal and see where we're going to go with that. Very exciting spleen responses. Indeed, the spleen responses at the 70% we have never seen with a single agent. We have to learn how does it translate into patients' benefits. A little bit more of a doubt, or we don't know what to think about symptoms, because they came quite comparable to the single agents, and that actually was across almost all of the frontline combos. So that's something we don't understand yet, and kind of like woke up the whole community to start discussing about what the endpoints are, which ones are relevant in the era of novel therapies that don't only basically trigger the JAK2, but also other pathways. And all of that is going to be pretty much the research for the next decade. The export inhibitor Selinexor with Ruxolitinib is showing very encouraging results. They are actually almost mind-blowing to me in the frontline setting as well as in the refractory, which has an updated data on both of these conferences. So that's something that we are looking forward to see. We are currently enrolling patients in those studies. To me, very nicely, some preclinicals, mechanistic data as well, and the phase 1s that are needed for patients failing JAK inhibitors. And as well, of course, we learn more details about how the JAK inhibitors are being used in clinic or in practice. For example, there's now more analysis on pacritinib and double cytopenias, so patients that had anemia and thrombocytopenia, and all of these details that we actually all going to have a post hoc once the drugs are approved. So all of those pieces are going to just give us more robust decision-making capacities, and the updates basically are on both of those studies. So that's pretty much what I'm looking forward to, and of course always seeing the mechanistic first, kind of like what did we learn more about the disease ideas, which all the researchers are looking at and analyzing their patients' data and seeing where the unmet needs and the gaps in the field are and where we should focus our therapies for development. So those are really exciting, and we keep the eyes open and just like in a cave, what we've got.